substances which they produce into lumens of hollow organs or onto the surface of the body. Yes. So as an endocrine gland, testes, they produce male sex hormones, androgens like testosterone. And as exocrine gland, they produce male sex cells, sperm cell. Yes. So sperm cell, it is produced in the testes.
Doctor, about the covering the testes,
Yes.
What is?
We will reach it. They are 7, yes. You should know also coverings of the testes. First, how to let it be. Let's talk about how to identify right and left testes. So this is testis. Here we can see it. It has two surfaces, medial surface and lateral surface. Medial surface is flattened and it is directed towards another testis. Lateral surface is convex and it is directed to the scrotum. Scrotum is a covering of testis, yes? One of the coverings. Yes. And also here, it has two borders, anterior border and posterior border. At the posterior border of testis, there is epididymis. So this is epididymis. Epididymis has head, body, and tail. Head of epididymis is located at the superior pole of the testis. So this is superior pole, this is lateral surface, this is posterior border. We also can see that between testis and epididymis, from the lateral side, there is sinus of testis. This is sinus of testis. It is formed by visceral layer of peritoneum that covers both testis and epididymis. From medial side, we cannot see the sinus. So it is medial, lateral, superior. It is posterior. So this one is left testis. Yes, left testis. No, this one is also left. Yes. Okay. So about external structure, I have already told you. During embryogenesis, testes, they are formed inside the abdominal cavity. But by the moment of birth, they descend, and they descend via the inguinal canal. And by the moment of birth, they should descend into scrotum. Why do we need the testes to descend into scrotum before birth? Because process of sperm cell formation, that is spermatogenesis, yes, it is
temperature.
It requires a definite temperature, and this temperature should be about 1 or 2 degrees. Mustafa, if you want, you can explain. I will go.
No, I'm sorry, doctor.
What? What did I want to say? Yes, this temperature should be lower, 1 or 2 degrees, than inside the abdominal cavity. Yes, so that's why they should descend into scrotum. If by the moment of birth testes didn't descend into scrotum, such a condition is named cryptorchidism, and it requires treatment, conservative, or if conservative doesn't help, then even surgical treatment. Because if it doesn't descend finally, then such a man will suffer from infertility. Yes, like sperm cells will not be produced. Okay. Yes. And while testis descends through the inguinal canal, yes, it takes with itself all the coverings. Totally there are 7 coverings of the testis. Each of these coverings, you have to know, all of them are derivatives of the layers of anterior abdominal wall. So the first layer, it is skin. Skin of the scrotum is wrinkled because the next layer is tunica dartas or dartas fascia. Skin originates from the skin, it's obviously, and tunica dartas originates from subcutaneous fatty tissue. But here in the tunica dartas, in the scrotum, there is no fatty tissue because fatty tissue is very energetic substance, yes, and it exactly this subcutaneous fatty tissue is responsible for increasing of temperature in the abdominal cavity, yes, and because here there is no fatty tissue, then here in the scrotum temperature is lower. So due to the absence of subcutaneous fatty tissue, skin here forms wrinkles. Yes, not like in all the other parts of the skin, of the body. And then the next, it will be external spermatic fascia. External spermatic fascia is formed by external oblique abdominis muscle. oblique aponeurosis, so, no, like it is derived from external oblique abdominis muscle. The next layer, it is cremasteric fascia and cremasteric muscle. So they are formed from internal. It seems to me I'm saying something wrong. Actually, there are some contradictions between Russian textbooks and Indian, for example, textbooks. So there are some contradictions. In some books, it's written that external spermatic fascia is a derivative of a superficial fascia of the abdomen. Then cremasteric fascia originates from aponeurosis of external oblique abdominis muscle, and then cremasteric muscle is formed from internal oblique abdominis muscle. Internal oblique abdominis muscle, yes. And then internal spermatic fascia is formed by transverse fascia. Yes, then it will be tunica vaginalis, yes, like serous, that is formed by peritoneum. Yes, tunica vaginalis, formed by peritoneum. So it is formed by peritoneum, yes, but again, by the moment of birth, this communication between serous cavities, which surrounds the testis, and peritoneal cavity, it should disappear. So there must be no communication. If there are some anomalies of development, then this communication stays till the end of the life, and such a person will suffer in future from indirect inguinal hernia. So intestines will pass through this communication and they will reach scrotum. But we will study it later. Now we are not interested. Okay, so this tunica vaginalis, it forms, like in peritoneal cavity, two layers. Visceral layer that surrounds the testis, and parietal layer that surrounds, like it is located, that adjoins internal spermatic fascia. And between visceral and parietal layers of this tunica vaginalis, again, there is serous cavity. And that's why if we compare number of serous cavities in male and female bodies, then in females they will be 4. Yes, there is peritoneal cavity, 2 pleural cavities, and pericardial cavity that surrounds the heart. And in males here there are 2 more serous cavities which surround testes. Yes. So what? Unfortunately, we didn't find preparation with a dissected testes. But testes, they are parenchymal organ. And here, closer to the posterior border, there is mediastinum testis. And here, closer to the anterior border, there are lobules. Lobules of testis. In each testis, there are from 250 to 300 lobules. In these lobules, they are separated from each other by connective tissue septs, yes? And in these lobules, there are seminiferous convoluted tubules. Seminiferous convoluted tubules. So they are coiled, they have very many curves. Seminiferous convoluted tubules are lined from inside by special type of spermatogenous epithelium. It is the only place where sperm cells can be formed. Yes? After that, all the other tubules, they serve just for passage. So from seminiferous convoluted tubules, these sperm cells, they move to the straight seminiferous tubules, then to the mediastinum testis, and then they move to the efferent ductiles, to the vas deferens, first to the epididymis, then it goes through the duct of epididymis, and then to the vas deferens. No, you will study it. Okay. So the only place where sperm cells are formed, these are seminiferous convoluted tubules. Morphofunctional unit of testis is lobule of testis. There are also cells, we'll discuss it at the lecture, but even you will also read it, that here in this lobule there are also special cells, Sertoli and Leydig cells. They produce hormones, androgens. So at the same time, there is place, seminiferous convoluted tubules which produce sperm cells, and there are cells which produce hormones. And so after that, certainly sperm cells, which are formed here in seminiferous convoluted tubules, they are not mature, yes, so they are unable to perform its function, yes, to fertilize the egg, yes, and then it goes to the epididymis. This is epididymis. So I told you it has head, coupled, body, and tail. and inside it there is a duct of epididymis. Duct of epididymis inferiorly at the inferior pole of testis forms a curve, like it continues to the deferent duct. Function of epididymis is maturation of sperm cells. So when they spend time here in the epididymis, they become mature, then they receive like acrosome, yes, that serves for, to dissolve membrane of the ovum, and also they become mobile, and so on. Yes, no, so that is epididymis. Then from epididymis, it goes to deferent duct. This is deferent duct, vas deferens. So it starts from the inferior pole of testis and it ends in the place where ampulla of vas deferens joins excretory duct of seminal vesicle. So here. It is very long and it has several parts. So the part that is between inferior pole of testis and superior pole of testis, it is scrotal part or testicular part. Then from the superior pole of testis up to the superficial inguinal ring, it is funicular part. Because here, from the superior pole of testis up to the deep inguinal ring, we will have such a structure that is named spermatic cord, funiculus spermaticus. So this part, before the superficial inguinal ring, it is funicular part. Then, in the inguinal canal, structure of inguinal canal, you will revise and you will explain me at the next lesson. Not I will explain you, because we have already studied it, but you will explain me. Are you recording? Inguinal part. And then, from the deep inguinal ring up to this formation of ejaculatory duct, it is pelvic part. This pelvic part. So, vas deferens serves for transport of sperm cells from the epididymis to the ejaculatory duct. And yes, spermatic cord. Spermatic cord, it is a structure, anatomical structure that contains vas deferens, testicular artery that brings oxygenated blood to the testis, pampiniform venous plexus, like veins which carry deoxygenated blood from the testis. Also cremasteric muscle. Cremasteric muscle is a special muscle that is inserted to the superior pole of testis and it pulls testis upward during its contraction. And all of the structures, they are covered by coverings. The same like coverings of testis, except skin and tunica dartus. So external spermatic fascia, cremasteric fascia, muscle, internal spermatic fascia, all of these structures, they are included into the spermatic cord. Spermatic cord starts from superior pole of testis and it ends at the deep inguinal ring. Okay, seminal vesicles. Here they are. So seminal vesicles, vesiculus glandulae seminalis. It is also internal male spermatic, internal male reproductive organ. The function of it is to produce a special substance that is rich with fructose for, like it is part of semen, to provide nutrition of sperm cells. So before sperm cells and also, in the deferent duct, these are only sperm cells move, yes? And when sperm cells join this substance, which is produced in the seminal vesicles, and then in the prostate gland also, all of these substances together with sperm cells, they form semen. Okay, so this is seminal vesicle. It is paired organ. Here we can see it. It is actually tubular organ, but these tubules, they are coiled very much, they are very much convoluted, and they form such a structure. Like it has apex, I think, you will check me, and then body, and then I think neck. No, I'm not sure. And then it continues with excretory duct. It joins seminal ampulla of deferent duct. So the very last part of deferent duct forms a dilation that is named ampulla, and so ampulla of vas deferens joins excretory duct of seminal vesicle, and it forms ejaculatory duct, ductus ejaculatorius. Yes. here we can see ductus ejaculatorius. So it is very small duct, and it opens, as I told you, into the prostatic part of male urethra. So male urethra, what you also have to know, it has several parts. We need, next time we need the other preparation. I think. So it has several parts, yes. So male urethra forms, like it is at the same time organ of urinary and male reproductive system. As organ of urinary system, it serves for excretion of urine, yes. As organ of a male reproductive system, it serves for excretion of semen into the female reproductive tract. So it has several parts. Prostatic, in some books it's written there is also pre-prostatic part, but it is very short. So prostatic part is that part that passes through the prostate gland. Then there is membranous part. At the next lesson, we will study perineum. So pelvic outlet in both males and females is closed by muscles. They are together like this. Not only muscles, but soft tissues all together form perineum. And when male urethra passes through this perineum, it is a membranous part. And the last part that passes through spongious body of penis, it is spongious part. Yes, the longest part. Okay, so diameter of the lumen of the male urethra is not equal at all the levels. So there are 3 constrictions and 3 dilations. Dilations are located in the prostatic part. So yes, in the prostatic part. Then there is one dilation in the bulb of penis. Yes, in the bulb of penis. And yes, you're welcome. And the last dilation is located here, at the very, not at the very end, but nearly at the very end, in the navicular fossa. There are also 3 constrictions. First is located at the level of internal urethral orifice. The last one is at the external urethral orifice. And one more constriction is located in the membranous part of male urethra. So when it passes through the perineum. Yes. Also, it has its way is not straight. Yes, you have to know the differences between male and female urethra. In females, urethra is shorter and wider. That's why women, they more often suffer from inflammatory diseases of urinary tract. And also in females, it is straight, like it opens to the vestibule of vagina, it is straight. In males, it is not straight. There are 2 curves. One is when it passes through membrane, in the membranous part, when it passes through the perineum, and the other is between root and body of penis. The other constriction, or the other curve, or what is it? Curve, let it be. Yes, that's what you have to know. Okay, and this is prostate gland. Prostate gland, glandula prostatica. It is also internal male reproductive organ. It is endocrine gland. It produces a substance that is required for mobility of sperm cell. So it is also composition of semen. And another function, it is muscular glandular organ. Fibers, muscular fibers of the prostate gland participate in formation of internal urethral sphincter. Internal urethral sphincter. Also, through the prostate gland, some ducts pass. Yes, so first of all, prostatic part of male urethra and also ejaculatory duct. And this part of prostate gland that is located between prostatic part of male urethra and 2 ejaculatory ducts, right and left, yes, it is named isthmus. Isthmus. And this part of male urethra, this part of prostate gland can undergo, and very often it happens in elder males, it can enlarge the size, like benign hyperplasia of prostate gland. And if it happens, such men, they suffer from urine retention. Yes. So urine, like it constricts this initial part of the male urethra, and urine cannot go out from the urinary bladder. Yes, and sometimes it requires even surgical treatment. Okay, so prostate topography is simple. Yes, it is located below the urinary bladder, and it has right and left lobes. Yes, I told you it's parenchymal organ, and it has numerous excretory ducts. What did I say in the crime? Yes, exocrine, certainly it's not. Yes, and excretory ducts of the prostate gland, they open also to the prostatic part of male urethra at the utriculus. At the posterior surface of the prostatic part of male urethra, there is an elevation that is named colliculus seminalis. And also there is, in the center, there is like utriculus. And that's where excretory ducts of prostate gland open. Yes, there is one more thing. There are also glands, bulbar, I forgot the name, but they, okay, Cooper's glands. Yes, Cooper's glands. These are also internal male reproductive organs, and they open into the bulb, into the very first, like into the very first part of spongious part of male urethra, and they serve for neutralization of pH in the male urethra before semen enters, because in the urine pH is slightly acidic. Sperm cells cannot live in this pH, they die, yes? And that's why before semen enters male urethra, these Cooper's glands, how is it named in English?
Secret.
No, the other name. The urethral glands, they excrete the substance to neutralize pH, to make it neutral, yes? And only after that, sperm cells enter male urethra. Yes. And so penis, yes, external male reproductive organ, very simple. You will read about it. There is root, body, then there is neck, and then there is head or glans. Yes. And here posteriorly there is raphe or suture. And what? If we talk about internal structure, there is one spongious body, corpus spongiosum, through which spongious part of male urethra passes. And there are cavernous bodies, corpus spongiosum, they appeared. Here there are like caves which can be filled in with venous blood. During sexual arousal, when outflow of venous blood is impaired, then this venous, caverns, they are filled in with blood, and erection becomes, like penis becomes straight. Such caves, like cave-like structures, they are present in spongious body also, but not in such a great amount. So mainly spongious body serves for excretion of the urine. Yes, one more thing. Cavernous bodies, they have equal diameter everywhere in all the parts of penis, and spongious body forms two dilations. Dilation in the distal part, it forms glans of penis, and at the proximal part it forms root or bulb of penis. That's it. You have also to read about fixation apparatus. There are ligaments. You will read it yourself, I think. And that is all. That's what you have to study for the next lesson. Any questions?
Okay, where Dr.